Good evening, Los Angeles. At the beginning of the COVID-19 pandemic, I spoke to all of you nearly every night from this podium to give you the information that we all needed to learn about this threat, to combat this threat, and to save lives. Increasingly, we looked at more, not just lives, but livelihoods that we could help address. And in the face of the double threat of COVID-19 and the economic downturn, this city rose to the occasion to do the work that was important, to protect our city, our family, and our neighborhoods. Since those earliest briefings, we've learned so much about COVID-19, even as there is so much we still don't know. We've recognized that we aren't moving past COVID-19. We're just learning how to live with it. Each day, we're getting a little smarter, but each day, the threat is still there. And I told you that I'd speak to you every time from this room, whenever I had an important message to share. And tonight, that message is this. It's fourfold. 1, COVID-19 is still here. 2, COVID-19 is still dangerous. 3, we're adding more testing to make sure that we can find COVID-19 where it lives. And 4, we must continue to take precautions to keep our city and our people safe. Today, the county reported 1,260 new cases, but the few days before, we've seen cases over 2,000 a day. Our total number of cases of people who have been infected is now just under 90,000 in LA County, 89,490. The new cases today were a 1% increase in the cumulative number, but again, some of the largest numbers that we've seen since this started. To put it in perspective now, 1 out of 400 people in Los Angeles County have had or do have COVID-19, and they are or have been infectious to those who are around them, their friends, their family, their coworkers, and others. That's why wearing a face covering, that's why practicing physical distancing, washing our hands, and yes, still, as painful as it might feel, staying at home whenever we can is our best defense in saving lives. In the city of Los Angeles, we marked 425 new cases today, bringing our total in the city of Los Angeles to 39,481 cases. It's a 1% increase. And we learned of 34 new deaths countywide. We've now lost more than 3,000 Angelinos, 3,205 to COVID-19. It's hit our families, it's hit our friends, it's hit all of our communities. And we mourn with everybody who is missing a loved one, who has not been able to say goodbye to them, who is not able to hold them, and who in this crisis couldn't even hold fellow family members in the midst of this. One of the troubling trends that we all need to be aware of, and I want to speak to young Angelinos, is that the rate of infections is on the rise among Angelinos who are 18 to 40 years old. In fact, 40% of all new infections are in this group. Just a month ago, that was 33%. Younger people are deciding maybe they're over COVID-19, or statistically, since they're less likely to die from it, that they can now violate some of the public orders that we have to get together in big groups, or just done with the physical distancing and wearing of masks. As I've always said from the beginning of this, each of us can be lifesavers. But the flip side of this is each one of us can be killers too. Folks that are spreading infection even if it doesn't affect you. And it's important to remember, we have lost the lives of people who are 18 to 40 years old from this coronavirus. From COVID-19, we see it does not discriminate, though we've learned just how much it does discriminate once people are infected. We need to make sure we continue to get tested. And it remains critical that people in every age group practice the vigilance and the personal responsibility of our fight against this. It's an honor system. We can do things to educate, to encourage, and yes, even sometimes enforce, but we'll never have the resources to do all of those three things for everybody. This relies on each one of us using good judgment, leading with love, and finding the actions that will save lives for the people around us. Our hospitalizations have remained steady. I know there's been a lot of news pieces about this, but now they are going up slightly. We track these numbers so assiduously to make sure that we can see any trends. And across the county today, in our general emergency hospitals, there are 772 beds, including 629 acute care beds and 143 ICU beds available, and an inventory of 1,258 available ventilators. These are still strong numbers. Some of those bed numbers are lower than in the past, but that's also because in hospitals, some of the beds that were surged up have been brought back and put back into other operations and remain available to surge up. Overall, the number of people in the hospital with COVID-19 has increased, now reaching 1,515, which is above the recent averages of about 1,350 to 1,450, but it still is well below our peak of over 1,900 in April. So this data I know can be confusing, but to me it sends a clear message that I want to share with you tonight. While you may be done with COVID, COVID is not done with us. And those numbers are going to be a reflection of lives lost in the future, or lives saved, depending on what I and you, what we do. Right now, we're in a new reality. We're not locked down, but we're not entirely opened up. I've always said we're living in the gray. Even at our quote-unquote worst moment, most restrictive moment, there was plenty that was open. Essential workers were out there. Stores were open for food and hardware. Our construction trades continued. And until we have a vaccine, we probably won't be 100% open, going back to large stadiums to see concerts or sporting events. So we live in this gray right now, and we're in between. It means that some activities and businesses are allowed to open, but they don't have to open. And it doesn't mean that we can avoid taking precautions. Simply because these places open, it even calls on us to make sure we are exercising those precautions more than before. We know exactly what to do to keep safe. You've heard me say it, you've heard Dr. Ferrer say it, you've heard it from Washington to Los Angeles and around the world. Avoid gatherings, wash your hands frequently, wear face covering, and physically distance. Testing has also been a critical tool, a part of our system of keeping you safe. And this is one of the best tools that we have to stop the spread of COVID-19. So as numbers go up, so too must testing. Today, I directed our team to scale testing to meet the immediate heightened demand. As of last week, we're meeting demand, but we found a couple days in which we didn't. So immediately, we are going to be scaling up our testing from 7,700 tests a day to a capacity of 13,700 tests, an increase of 6,000 more tests a day starting tomorrow across our 7 city test sites. And more testing appointments are being added all the time. I also want to remind you that there's testing outside these centers. Testing is now increasingly and almost somewhat universally available through your healthcare providers, at our CVS pharmacies, through some state testing centers. So there should be tests for everyone, but we know a lot of people rely on the city and county testing sites, which is why we want to scale that up immediately. And while the city of Los Angeles does not have a public health department, the Los Angeles County Public Health Department is ours, like it is for 86 of the 88 cities in LA County. We moved very quickly, as you know, as a city, to scale up testing and an infrastructure that didn't discriminate on whether you were a resident of the city of LA or another city in LA County, that didn't ask whether you had symptoms or not, that provided what we needed to make sure that our work in bending the curve was effective. And because we took those actions, we saved lives. Since I last spoke to you, studies showed that across America, early actions taken by cities like Los Angeles saved hundreds of thousands of American lives, even as we mourn those that are lost. Our program here bought time for healthcare providers, for pharmacies, hospitals, and community health centers to set up their own testing, and that's what's happening now. To date, we've spent in the city of Los Angeles $70 million on testing, and we were never meant to be the sole provider of tests. Unlike our state and county partners, we've not received any direct funds from our federal government for this testing, specifically put forward for that. So over time, you will see us transition to be a facilitator of our partnership rather than just a provider of tests, making sure that we play a leading role in ensuring everybody gets tests conveniently and hopefully close to the healthcare providers that you use. But today, we still have a system that not only works, but is expanded for your convenience. So go to coronavirus.lacity.org/testing and sign up if you need a test. I've encouraged you from this podium, if you've been out in protest, get tested. Now, in fact, if you haven't been on the streets for a week or so, it's a perfect time to get that test to see whether there is any impact and any spread from the protests. Testing remains free for everyone, whether you have insurance or whether you don't. And if you have insurance, the website will ask you to provide that information so that we can ask insurance companies to help shoulder this cost, so we don't have to take it out of other critical city programs that provide the human services that you need. By law, this test is free, and no insurance company can charge you any copay, deductible, or a fee for the test. That is the law of the land. Adding your insurance information will also allow us to continue offering tests and keep city resources for other COVID-19 response and recovery efforts, whether it's buying PPE for our hospital workers, whether it's working to house our homeless Angelinos who are at threat of getting COVID-19, or providing childcare to our healthcare providers. It matters that testing is widely available, but it also matters where testing is available, and equity has guided our response. I'm so proud that even before the protests for racial justice, we looked at this through a racial justice lens. At the beginning of this, you'll recall I talked about how we had 8% of the population of LA County was African American, but 16% of the deaths. Today, I'm proud to say that we have brought that number down, cut it by 2/3. It still is disproportionate, and we're not going to rest, but 11% of the deaths now in a county where 8 to 9% of the population is African American are in the Black community. This is the sort of lens we must apply to everything we're doing, so that somebody's color, somebody's zip code, somebody's age, somebody's pre-existing condition doesn't become a death sentence for them. And we're monitoring these racial and ethnic demographics to address disparities, to make sure Los Angeles can lead. And we're working with healthcare providers like Kaiser to connect members to seeking tests to the tests that they need now. So you don't have to always go to a city or county site to get tested. You can go to the doctors that you know, the buildings that you know, the places that you're comfortable getting your health care. And we're continuing to make testing available to vulnerable populations. At skilled nursing facilities, we've completed tests at all of them with our skilled nursing facilities at 135 across LA City, and we know that will save lives of seniors who have been the most vulnerable. We've also done this now at our public housing departments. Yesterday at Pueblo del Rio, one of our housing developments, we announced a new effort with the Housing Authority of Los Angeles, our fire department, and the marvelous volunteers at CORE to deploy mobile COVID-19 testing units to all 15 public housing developments in the city of Los Angeles, delivering free on-site testing to all Angelinos living there, nearly 25,000 residents, many of whom lack access to reliable transportation options to get them to nearby testing sites. This transition is the responsible way to move forward, fiscally, ethically, and medically. It will help us save more lives. In addition, nearly 300 employees of the City of Los Angeles signed up as disaster service workers and are helping our county Department of Public Health do the contact tracing that is our other key weapon in the fight against COVID-19. They will track and talk to people who've been in close contact with those who test positive to limit community spread. So if a member of the contact team reaches out to you, it'll appear on your phone as LA Public Health, and please, please answer. They will leave a message if you don't, and I hope you'll call them back, because that decision will save lives. They're not law enforcement agents. They will never ask for personal information or your immigration status. They will only ask you who you were in contact with, so we can then contact them and make sure that people quarantine so that more people don't get sick and die. That is our responsibility, and I want to thank them for stepping up. People who have worked in other city departments, from our libraries to Rec and Parks, Public Works, and others, who are becoming these contact tracers alongside their colleagues at LA County. Testing and contact tracing helps protect all of us at a time when COVID-19 has brought new vulnerability to the lives of so many in our city. Jobs that seemed secure have disappeared almost overnight. Small businesses have found themselves unable to meet payroll, and they wonder if they will survive. Families are being confronted with impossible choices every single day. Last month, I joined with my colleague, Council President Nury Martinez, and a number of city council members. When we came together and looked at our coronavirus relief funds, we decided to put $100 million, the most in the country, we believe, ×4, in a renter relief program to help people meet their rent and to help those mom and pop landlords be able to make sure that their properties don't get seized by the banks. Yesterday, City Council passed that legislation, and today, right here, the proof, I signed it into law. It's one of the proudest things that I've done, and I want to thank Council President Martinez and her colleagues for working together with this administration to ensure that we don't just save lives, we address livelihoods, that we don't see more evictions and people who are lost to this crisis, to the streets of Los Angeles. This program will put up to $2,000 into the hands of our hardest hit households to help with rent over a 2-month period, and it couldn't come at a more important time. Eligible tenants are those whose household income is at or below 80% of the area median income, which is $83,500 for a family of 4. Applications will begin in early July. I'll be sure to announce the day it's available, together with Council President Martinez and others. And there'll be more information to share soon at our city's housing website at hcidla.lacity.org. This action builds on other tenant protections that LA has led with, from ordering a moratorium on COVID-related evictions, freezing rental increases for 80% of our city's rental units, those that are in our rent stabilization ordinance, and working with my council colleagues to prohibit landlords from taking advantage of their tenants and guaranteeing renters a private right of action if emergency protections are violated. We're also looking at legal protections, counsel to be able to help folks when the crisis is over, to make sure nobody winds up on the street in a violation of the law. And we're confronting economic inequality throughout this crisis through a variety of means, including delivering Angelino cards to families that are struggling to make ends meet. If you recall, when I first talked about this, our ambition was to try to get $13 million raised for the Angelino cards. And today we crossed an important milestone. We've now distributed more than $30 million in Angelino cards, more than double the initial ambitions that we had. And I've announced so many of those donors right here, and I want to thank them all, from the $5 donation to the $5 million donation that literally has saved people's lives. We don't have enough time in this briefing to share the stories, but I get videos and letters and notes from people who describe what this has meant to them, to be able to pay off their bills, to meet their rent, to have the most basic things that they need to survive this moment. It hasn't just been help. It has literally been hope for so many. Thank you for your donations. This has been a huge team effort, unprecedented. I want to thank my Deputy Chief of Staff, who has worked on this so strongly, Mary Hodge, all of the folks at HCID-LA, our Housing and Community Investment Department, and everybody at our 21 Family Source Centers, Work Source Centers, and Youth Source Centers who have distributed these cards together with the Mayor's Fund. Thank you for your life-changing work. I'd like to also remind everybody that there's something important you can do that will help our city get the resources we need to continue to deliver the services you depend on, and that is completing the 2020 census. We have seen that Los Angeles is always undercounted. If you care about Black lives in this city, make sure you are counted. If you care about immigrants in this city, make sure you are counted. If you want to see our schools funded, our public transportation funded, poverty alleviated, racial justice addressed, these all depend on formulas based on the number of people that fill out the census. And year after year, decade after decade, we leave billions of dollars, not just in Washington, D.C., but redistributed to other parts of the country, our taxpayer money that doesn't come home. A full and accurate census determines also the number of representatives we have in Congress, how much federal money we get for emergencies like this one, our preschool and children's health programs, so much more. But our response rate, unfortunately, is only to date 51%, far behind where we were a decade ago. And I know the stress is going on in your life, but if you're stressed about there not being enough, it's a perfect time to connect these dots and to fill out your census form. I can't say enough, but go to my2020census.gov, and you can fill out the form you received in the mail too, send it back if you don't have internet access, or call in your answers. If you haven't, pick up the phone right after this briefing and call 844-330-2020. Be counted today. And for immigrant Angelinos who are worried, your information is confidential. By law, it cannot be shared with other bureaus, departments, administrations inside the federal government. So it takes about 10 minutes of time, but I guarantee you, it will bring thousands of dollars to you directly in making sure that you are counted. So my friends, here's the bottom line. COVID-19 is still serious. It can still make you sick, and it can still kill you or a loved one. The virus has not gone anywhere. It's here, alive and well. It prospers from our divisions. It thrives on our exhaustion. Every time you say, I can get closer than 6 feet, I don't need to wash my hands, I can bend or break that rule, it thrives. But we have so many advantages today that we didn't have when this virus first hit Los Angeles. We know how to live safely, and we have the tools and the knowledge to stay healthy. So I want to impress upon each one of you the role that you have played so beautifully. We've seen people rise up to reclaim their democracy. We've seen people rise up to help save lives. We've seen people rise up to generously give to their neighbors and help them get through this time that they are vulnerable and feeling hopeless. Our personal decisions will change the course of history. How we meet this moment and not miss this moment. Write this chapter, not just through the pain of this time, but also through the promise of it. To not go back to normal, but to reimagine what Los Angeles should be and what America should be in the future. And that's how I know we can do it again, because we've done it so far. It's why we shouldn't feel powerless or helpless. You have a role to directly play. In the face of these unsettling and newly high numbers, our role should be to double down on what we've done and what we've done right. We have everything we need to get through this together. We've got one another. We've got our brilliance. We've got our caring. So as always, wear a face covering. Keep your distance and always stay safe. Stay healthy. And yes, I'm sorry, still, whenever you can, stay at home. Here's to strength to all of you and love to each one of you and justice for all of us in the days ahead. Thank you, Los Angeles. And with that, I'd be happy to take questions. First question, please.
Thank you, ladies and gentlemen. If you would like to ask a question, please press 1, then 0. And our first question comes from Ryan Carter from the Los Angeles Daily News. Please go ahead.
Hi, Ryan.
Hi, Mayor. How you doing?
I'm okay. How you doing?
Good. Thank you kindly. All right. So on the scaling up of the testing, I wanted to ask. You were very specific to the city scaling up on that. Does that also include the county? And I ask in the spirit of a news release that went out this week about announcing that the city was paring back even while there was sort of an increased demand. At least that's how I took it. And so I guess I wondered if you could reconcile those two elements for me all at the same time.
Sure.
Is this testing ramping up at the city's current sites and what that might look like?
Absolutely. So a couple things. One, I think that was a draft and they changed that because it was inaccurate. Collectively, the county and the city have looked at, over time, the volume in our testing centers moving to where we all get health care, whether that's through a clinic, whether that's through our healthcare providers, and that is the sustainable model over time. But I think we all recognize today the quickest way to get a test, the way people are most familiar with, is through our testing sites. So I want to be clear, this wasn't something 2 weeks ago where people were getting pushed forward. It happened a few days ago. I think it was after we encouraged people to go out there after the protests, and also because we saw numbers begin to tick up. So within just 2 days, we've said, no, let's ramp up those testing centers. But capacity was never pared back. Part of that has scaled up, in fact, through clinics. And I know the county has really looked at clinics. They've looked at healthcare providers. And then we will always fill in those places in the most vulnerable, in our senior nursing facilities, in our homeless population, in looking at places like our public housing. So we're shifting to other partners. But right now, I told my team, I don't care. We have to, as we always have, step up. And so we're adding 6,000 tests per day. Just a few weeks ago, we weren't even meeting the capacity we had. So people were just testing less. Within a week or 10 days, that flipped quickly, and we're going to flip quickly to meet it. Thanks. Next question.
And that comes from Elizabeth Chow from the LA Daily News. Please go ahead.
Hi, Liz.
Hi, Mayor. I have two different types of questions about hiring today. The first one is regarding a former deputy mayor for economic development. I wanted to find out if there were any red flags or complaints that came up for not only the hiring of this person as a deputy mayor, but also from going from the interim general manager to being the general manager of the Department of Building and Safety, and whether or not that it gave you pause if there were any complaints, and whether this hire had, I guess, was well recommended for the position that this person filled.
Okay.
And the second question, and also in terms of the hires, did this person get pay increases each time? And what kind of vetting do you do when you do these appointments?
Sure. And what's the second part?
Is the black staffers that appear to have been promoted in your office, and what the significance of that is for you. Thank you.
Okay, great. Recently, I've promoted people who we've been planning on promoting for some time, and it's a reflection of their brilliance, nothing else. We have amazing folks who have led. I think you've heard me. I've gotten to say the names of my staffers who often toil away in anonymity, but I have an extraordinary people of all backgrounds who work in this office, who have led in health, who have led in city services, who have led in our budget, who have led in economic development and economic opportunity, in homelessness, and it's a recognition of those. So some of those promotions have been in the works for a long time. COVID-19 has made it difficult because not everybody is here, but very proud of those. And some of them recognize the years of experience for somebody like Deputy Mayor Brenda Shockley, who is the city's first chief equity officer, who founded Community Build, came out of the ashes of 1992. I hired her because of her extraordinary brilliance in coalition building, her experience in community building and affordable housing, and the work that she's done speaks for itself. So the right people are in the right place at the right time. From the first question, no, there weren't any red flags, though clearly, I want to say very, very clearly that all of the investigations, I want to thank, first of all, the FBI. I want to thank the U.S. Attorney and congratulate them and tell people that anybody knows anything should be prepared to cooperate, and anybody who's done anything should be prepared to pay the price. In that particular instance, no. I only had great things that people said, from community to the business world, of the way that, building and safety, which at the time had been a place where things went to die, where the bureaucracy had not helped neighborhood groups or folks looking to get things done in Los Angeles, that he had come with all high marks. But obviously that investigation is ongoing. We do a deep vet with everybody. But I'm convinced through this that people who want to do something bad will always find a way around the system. And while he wasn't deputy mayor very long here, it was just over a year, the disappointment of what I've read speaks for itself. And I would call on the council, now that we've seen the arrest and the charges of Councilmember Huizar, to take a further step from the one that we've done together, which was to ban developer contributions. I'd like to see a system like we have at LA Metro, when whether it's a family member or a colleague of somebody, if there is a contract, or in this case, a development in front of council members and there's been donations given, they can't vote. That would finally dry up the ability of anybody wanting to do the wrong thing, that they would think that they could buy influence, because the moment you give money, that person can't even vote on your project. So I'm going to work with the council to put that on a future ballot. It works very well at LA Metro, and I think that we should have it here in Los Angeles. Thanks, Liz. Next question.
Thank you, and that comes from Claudia Peshuta from KNX News Radio.
Hey, Claudia.
Sorry if I missed this. I had some technical difficulties at the beginning.
No problem.
Did you say anything about a change in COVID testing vendor and why that's happening? That's what the county said in its release yesterday. There's no indication that release was a draft. The county never went back on saying that the city was tearing back testing. So I've been trying to clarify this with people in your office for 24 hours, and all I got was more appointments are coming. So is there a change in vendor, and if so, why? And then my second question is, you brought up concerns about rising cases among young people. We also saw a big jump this week in cases among LAPD officers. All this comes about a month after the mass protests began. So do you have any concerns about the the fact that significant reopening measures have come at the same time as big protests, and whether all that may have compounded the possible risks of reopening, and if we're just starting to see the effects of all that now, 4 weeks later. Thank you.
Thank you, Claudia. Yeah, I am worried. This is one of the reasons that I decided to do another address tonight. I only try to do these when there's really important information, and it does trouble me. It's not as alarmist sometimes as the headlines say. These numbers remain under the peaks that we had when we were more restricted and more closed. We still have good bed capacity. We see deaths still going down. But there are some worrying signals. We have to really interpret them, I think, very sensitively. When we see whether it's an uptick in people calling a telemedicine helpline with symptoms that sound like COVID-19, whether it's our positivity rate, which has gone up, to still numbers that were way below the positivity rate a couple months ago, but still going up a fraction each day. These together are signs that we better all get our acts together. We better all continue to be very vigilant with our behavior of wearing masks, physically distancing, washing our hands, staying at home, not breaking those rules. So absolutely, I think that is very important. And especially among young people, that's not new just to Los Angeles. It's tough, don't get me wrong. People see images of folks in a bar in another state, and they're like, God, I'd love to see my friends. But if you don't do this in a reasonable way, you could kill yourself, you could kill a friend, or bring that home to a family member. In terms of the changes, we're not changing vendors. We're changing models to bring private insurance in to increasingly cover the costs of this, so it doesn't have to come out of the pocket of taxpayers, even though we get 3/4 reimbursement. And I did announce, yes, that we went from 7,700, we added 6,000 more daily capacity, so that we'll go to 13,700. And trust me, I had those conversations directly with the county. They said the county and the city were both going to not ramp down testing, but move from testing centers to the health clinics, the providers, the doctors, the community health providers that most of us depend on. But while that might be happening long term, and that may be a sound strategy from the county and that the city may join, I didn't want to wait or have us be flat-footed where people were saying, look, I don't know where to go to. I need a test today, and especially after the protests and others, to make sure whether it's our first responders like police officers and firefighters and other city workers working in places like our homeless shelters, or folks who've been exercising their First Amendment rights and standing up for racial justice. We need to meet that moment. I'm glad we could flip that in a couple days. Thanks, Claudia. Next question, please.
Thank you.
Thank you. And now to the line of Tom Tapp from the Deadline. Please go ahead.
Hi, Tom.
Hi, Mr. Mayor. Hi. So I need some help with some numbers here. I heard you say that there were 425 new cases in the city reported today and 1,260 in the county.
Yes.
So the state reported 7,149 new cases, and almost always LA County and LA City is the lion's share of that state number. And I'm wondering, especially since the county number yesterday was about over 1,000 higher than it was today, what accounts for the variation and the discrepancy that seems to be there, especially since the state site is reporting 2,508 new cases today for the county of Los Angeles.
Right. So welcome to our world of imperfect data. I've gotten to know these numbers really well. It comes from a couple things. There's usually a state lag that they put in stuff, not just from the last 24 hours, but it may be them updating the website. So they're just reporting what they've found out in the last 24 hours, and that may be from 36, 48 hours before. The numbers from LA County are always reliable. But that said, they also reflect that sometimes these come in batches, that certain labs that have not reported finally are reporting. So it doesn't always reflect a 24-hour period of tests that have been completed. It just means what came in that 24-hour period. That's why I use an average of 7 days. So we compute the 7 days before today, what is the average, all those cases divided by 7, and I track that. Along those lines, it's been pretty consistent, and we've seen an uptick. But you make a good point. Traditionally, we've been about half of the state cases, And LA City has been at least 40% of the county cases, which is our population of LA County. We're now seeing a trend over the last week or so of LA City being smaller than a 40% portion of the county, and the county no longer being about half of the state cases. So this is a message for, and I know we have listeners and people who tune in from the surrounding areas, that whether it's in Northern California or some of the surrounding counties, there was an article today how Ventura, San Bernardino, Riverside, Orange County, who did open up more quickly and sometimes have had, battles about whether to wear masks or not, and public health officials' recommendations and political leaders. We've got to be in this together. When some folks have asked, why don't you keep the gyms closed or the bars closed, I've always said, if the region doesn't do it together, we're all part of one public health zone. Somebody can go across the street from Long Beach into Orange County and Seal Beach and go to a bar and come home to Long Beach. Somebody can get their hair cut, across the border in Simi Valley, can be in Ventura County. We have to move together, and I hope that just as we've seen up north, that the 5 and 6 counties of Southern California will act together so that if things do get bad and we do need to retreat at all, we'll do that in unison, or if we're telling people we can continue this, but we really have to, as I've said tonight, wear those masks, keep your physical distancing, make sure you're washing your hands. That message is equally around. Those numbers could flip. We're used to them changing within a week or two, but you are accurate that there is now a lower percentage of LA City within LA County, a lower percentage of LA County in terms of the state, and you'll see that unevenness just because of the way the state records them. Sometimes they have that data but don't input it in that 24-hour period. The LA County numbers are accurate, and they come in fits. They come in from batches from labs, as well as a consistent, steady stream from some of the people that report every single day. Hope that clarifies. Thank you. Next question, please.
Sure. Thank you.
You bet.
Thank you. And our final question for today will be in Spanish, and it comes from the line of Abel Alamillo from Telemundo 52. Please go ahead.
Hola, Abel.
Hola, alcalde. With COVID-19 cases reaching record levels the past few days, are you reconsidering some of your reopening orders? And also, can we just get your reaction in regards to Councilman Jose Huizar's arrest?
Absolutely. So let me start with Councilmember Huizar. I just can't express how deeply disappointed I am. And to me, to take the public trust and to violate it in the way that the FBI has clearly shown, and to do it not just as a one-off, but as something that seems to be calculated and ongoing, to me is a betrayal of who we are as public servants. There's no place for it. I have zero tolerance for it. And I hope Councilmember Huizar is prepared to face the law. This is a city that one person, as we've seen, can change it for everybody. A handful of people can do something wrong, and 40,000 city employees are all found guilty in the eyes of folks. We have to reestablish that trust. We have to change those rules so that trust can't be betrayed. And people need to be prepared to pay the consequences. I'll say that in Spanish as well in a minute. In terms of opening too fast, I want to remind folks the state permits what counties can do. The counties then mandate what is allowed. Cities have limited power there. So a lot of people always ask me, why aren't you opening things up more quickly? We don't have the power to do that. And we could, on the opposite side, keep things closed. But if I closed a gym in Hollywood and people can go to West Hollywood, there's no public health benefit. There's only a punishment of those businesses. So I've focused on trying to make sure businesses know the protocols, that they enact the safety for their workers and their customers. And I do think that we can get through this without seeing a huge surge. But this is the central message of my address today. That relies on each one of us. It relies on us not being macho about wearing a mask. It relies on each one of us doing the things that we know to do and being patient about maybe if you can work now, go to work and then go home. Don't expand your pod. Don't violate the rules of group gatherings. Don't do those things that we know spread this virus. So también en español, desafortunadamente, las acciones del concejal Huizar desafortunadamente son parte aquí de un mensaje muy negativo, un mensaje que este ayuntamiento es un lugar donde una persona puede comprar un representativo elegido de la ciudad de Los Ángeles. Yo tengo cero tolerancia por estas acciones y el concejal debe preparar por las consecuencias, porque hay muchas personas que cada día han dado sus vidas a servir a la gente de Los Ángeles. Los sacrificios del tiempo con nuestras familias, las horas muy largas. Todo este servicio es importante, en mi opinión, es sagrada, pero pues acciones sin respeto por la gente que son parte del servicio del gobierno local. Y como el alcalde de la ciudad de Los Ángeles, espero que las consecuencias serán severas. También yo tengo un poco miedo de la reapertura de muchas cosas en la sociedad, pero no podemos parar esto. El poder, las regulaciones son con el Estado y el condado de Los Ángeles. Yo soy un alcalde de una de las 88 ciudades del condado de Los Ángeles. Yo puedo parar la reapertura de Los Ángeles, pero sin efecto, porque si los gimnasios no están abiertos en Los Ángeles, la gente de Los Ángeles, la ciudad de Los Ángeles, puede ir a un gimnasio en West Hollywood o en Santa Mónica. Debe tomar acciones juntos, especialmente porque hay más casos de COVID-19 en el condado cerca de Los Ángeles, en Ventura, en Orange County, en el condado de Orange, en San Bernardino y Riverside. Y espero que nosotros podamos realizar que nuestras acciones pueden salvar vidas. Y nosotros podemos vivir con COVID-19, pero es importante tener sus coberturas faciales para lavar las manos y a regresar a nuestros hogares después de trabajo, porque sin estos actos, más personas morirán. With that, I'm going to give my overall address in Spanish. I want to thank everybody as well who are out there fighting on racial justice, who are fighting to save lives, who are helping people with livelihoods. And my message is the same. Los Angeles, we will get through this, and we will get through it together with the strength and the love and the justice we all deserve. Muy buenas tardes, Los Ángeles. Me comunico con ustedes hoy con un mensaje muy importante, que el número de casos de COVID-19 en Los Ángeles está subiendo. El virus no se ha ido y sigue siendo mortal. Estamos agregando más pruebas y debemos seguir tomando precauciones para mantenernos seguros. Los datos. Hoy el condado nos informó de 1,260 nuevos casos. En total, tenemos 89,490 casos en el condado de Los Ángeles. Esto significa que una persona entre cada 400 está infectado con el COVID-19 y puede infectar a aquellos alrededor de ellos. Por eso es tan importante llevar una cobertura facial, practicar higiene adecuada y mantener sana distancia. Estas son las armas contra COVID-19 en nuestra ciudad y en nuestro país. En la ciudad tuvimos 425 nuevos casos, gracias a los residentes de Los Ángeles, la ciudad de Los Ángeles, porque este es menos de nuestro por ciento de población en el condado. Y con estos números llegando a un total de 39,841 casos. Y tristemente, fallecieron 34 personas más en el condado de Los Ángeles, llegando a un total de 3,205 fallecidos. El 40% de nuevos casos de infección tienen entre 18 y 40 años. Esto es un aumento del 33% el mes pasado. Por eso es crítico que todos sigan los protocolos de infección para protegerse a ellos mismos y sus familiares, quienes pueden ser vulnerables al COVID-19. Las hospitalizaciones han estado estables, pero ahora están subiendo un poco. En el condado tenemos 772 camas de hospital, entre ellos 143 camas de cuidado intensivo y 1,258 respiradores disponibles. Ahora estamos en una nueva realidad. No estamos bajo cierre, pero tampoco estamos completamente abiertos. Estamos en medio. Aún con abrir ciertas actividades y negocios, esto no significa que podemos evitar precauciones. Evite reuniones, lave sus manos, lleva una cobertura facial y mantenga la sana distancia. Las pruebas de detección también son críticos en mantener a angelinos seguros y frenar el brote de COVID-19. Por eso lanzamos nuestro programa de pruebas para llenar un vacío nacional. Aunque no tenemos un departamento de salud pública en la ciudad de Los Ángeles, es un parte del gobierno del condado de Los Ángeles, tomamos acción inmediata para establecer una infraestructura para pruebas y salvamos vidas, mucha gente. Mientras tanto, los proveedores de servicios de salud han podido establecer sus propias operaciones de pruebas, Kaiser y otros hospitales, y esto es lo que está pasando ahora. La ciudad de Los Ángeles ha gastado aproximadamente $70 millones en nuestro programa de pruebas de detección. Sin embargo, la ciudad nunca debería de ser la única entidad ofreciendo pruebas. Y a diferencia del estado y el condado, no hemos recibido fondos federales específicamente para hacer pruebas. Por eso, la ciudad va a empezar una transición hacia facilitar colaboraciones en vez de proveer las pruebas. Y tomaremos un papel central en asegurar que todos reciban una prueba. Para ser claro, la ciudad sigue ofreciendo pruebas y para satisfacer la alta demanda, inmediatamente esta semana estamos agregando 6,000 pruebas más al día para lograr una capacidad diaria de hacerle pruebas a casi 14,000 personas en los 7 sitios de pruebas de la ciudad. Nuestra página web, coronavirus.lacity.org/testing, se ha actualizado con un mapa interactivo junto con un directorio de 90 sitios donde se puede hacer la prueba. Las pruebas siguen siendo gratis para todos, aunque tengan seguro de salud o no. Si lo tienen, la página web le pide que comparta esa información para que lo podamos pedir a la compañía de seguro que compartan el costo de este programa de pruebas. La ley indica que la prueba es gratis y ninguna compañía de seguro de salud le puede cobrar por un examen. La equidad también nos ha guiado durante este esfuerzo. Por eso, la ciudad está coordinando con el condado para asegurar que haya un sitio de pruebas cerca a cada comunidad. Y tenemos pruebas accesibles para poblaciones vulnerables, como los centros de enfermería especializada, comunidades de vivienda pública y nuestros vecinos sin hogar. Esta transición es la manera responsable de avanzar y nos ayudará a salvar vidas. Además, 234 empleados de la ciudad de Los Ángeles se han unido al programa del condado para localización de contactos, lo cual nos ayudará a identificar personas quienes han estado en contacto con personas infectadas y limitar la propagación en la comunidad. Si alguien de este equipo te llama, LA Public Health aparecerá en su teléfono. Por favor, responde a esta llamada. No son agentes de policía, ni les preguntará de su estatus migratorio, solo le preguntarán sobre los últimos contactos. Ayer el Consejo Municipal aprobó la legislación para el Fondo de alivio de emergencia para inquilinos, lo cual aplica 100 millones de dólares del Fondo de Alivio de COVID de la ciudad para apoyar a inquilinos. Y hoy firme esta ley. Gracias a la presidenta del Consejo Municipal Martínez, los miembros del Consejo Municipal por su liderazgo en esto. Aplicaciones empiezan en julio. Para más información, visita la página de nuestro Departamento de Vivienda, hcidla.lacity.org. Además, hoy puedo anunciar que hasta ahora hemos distribuido más de 30 millones de dólares en tarjetas Angelino para familias pasando por dificultades económicas. Además, quisiera tomar esta oportunidad para recordarles que, por favor, completen el Censo 2020 para ayudar a nuestra ciudad a obtener los recursos que necesitamos para brindar servicios críticos, nuestras escuelas, nuestra salud, nuestros hijos, nuestros sistemas antipobreza. Estos programas dependen en los números en el censo en Los Ángeles. Este es tu dinero. No da este dinero a otros estados o ciudades. Ustedes merecen este dinero. Ahora nuestra tasa de respuesta es desafortunadamente solamente 51% de la población. Si seguimos así, sufrirá nuestra calidad de vida. Es crítico que todos se hagan contar. Solo se necesita su teléfono o computadora para responder en la página my2020census.gov o por correo o por teléfono al 844-330-2020. Y toda su información es confidencial. La ley federal prohíbe compartir estos detalles con cualquier otra agencia gubernamental. Sin documentos, con documentos, especialmente para nuestra comunidad, por los inmigrantes, es importante responder al censo. Su familia necesita su participación. El COVID-19 es muy serio. Todavía se puede enfermar y todavía lo puede matar. No se ha desaparecido este virus. Pero tenemos la información y las herramientas para protegernos. Nuestras decisiones pueden afectar el impacto de este virus. Entonces, lleva una cobertura facial, mantenga la sana distancia y, como siempre, quédense protegidos, quédense en buena salud y quédense en casa. Fuerza y amor y justicia en Los Ángeles. Gracias y buenas tardes. Good evening, everyone.